Well, you are in for a special treat today. Today, you get to hear from three rehabilitation professionals. We have Cindy, who is a physical therapist, Christina, who is a speech therapist, and then me, who is an occupational therapist. And we're talking about how rehabilitation therapy can benefit your loved one or you as a family caregiver when you're helping a person living with dementia. And I invite you to stick around to the end. Christina and Cindy have a wonderful offer for you. And then remember, if you are ready to work with me a little bit closer related to helping a family member living with dementia, I invite you to go and register for my free monthly workshop. And the link is in the show notes below. Hey there, success seeker. Welcome to Dementia Caregiving for Families. Do you feel overwhelmed with the daily struggle of dementia caregiving? Looking for an easier path? You're in the right place. On this podcast, we teach you the skills to simplify caregiving. We unravel the mystery of dementia and guide you through the often difficult behaviors. I'm Lizette, your host and fellow family caregiver. As an occupational therapist, I bring my professional and personal experience to this community. Here we speak the truth, but without the verbal vomit. I know you will find value in today's program, so buckle up while this flight takes off. Well, welcome back to today's episode of Dementia Caregiving for Families. And I am very excited today to have two guests, two very special guests. And they're special because they are therapists like me. And we are going to talk a little bit about physical therapy and occupational therapy and speech therapy related to dementia and dementia caregiving. But my guests today are Cindy. She is a physical therapist, and Christina. She is a speech therapist. And so I'd like the ladies to take it away and tell us a little bit about themselves and how they help people living with dementia.
Excellent. So my name is Cindy, physical therapist. I have been in practice for about 30 years now, and the majority of my time has been spent in home health. And I'll let Christina take it away as far as herself and our business.
Yeah. And I'm Christina. I am a speech therapist, and I have most of my career has been spent in treating people in long-term care and rehabilitation facilities and long-term care. I have been doing this for probably close to 25 years, maybe 25 years. And as speech therapy and occupational therapy, I think it's interesting, Liz, that with us being, we're like the trifecta, right? We're like the dream team, right? We got PT, OT, and ST. And the occupational therapy, in my opinion, is kind of that connection between PT and ST.
Yes.
You guys always, you either work with you work on your own, or you work with PT, or you work with speech therapy. And so I just think that's fascinating. And if anybody, you get a chance to talk to the OTs and speech and PT and stuff, I just think it'd be a great service for you to get to just ask people about their therapy experiences. But the majority of my time has been in long-term care. In particular, we had almost every long-term care facility I worked in, we had a dementia care unit. I loved working in the dementia care unit. I loved working with my residents that were living with dementia. Lots of times what we did, we would work on, in particular, we would work a lot on swallowing. Swallowing was an issue, but we would also work on some cognitive things. It wasn't even so much about training or educating as just getting that using that rote memory or that procedural memory and making it work for that particular individual, or working with the staff and showing them ways to work with their resident that they are working with, and what works best for their resident, because it's not a one size fits all kind of treatment thing. And so I think that's what I like most about working with people living with dementia was you got to know them and know a little bit of who they were, what they did for a living, and you get to reminisce with them about it, you know,
I
and which,
love that.
you know, for speech therapy is huge. You know, that's a great way to communicate with people. But we also work with the swallowing stuff as well, because it's one of the, you know, it seems to be one of the things that as dementia progresses, people lose their ability to swallow safely. And we get a lot of people that are aspirating and they get pneumonia. That increases the risk for pneumonia. So I absolutely love working not only with the residents, but also working with the family caregivers too.
For sure. Well, we have a lot in common because I agree with you. The occupational therapist is the bridge between the physical therapist and the speech therapist. But what I've always found fascinating is if you spend enough time around PTs and OTs and speech therapists, we're actually very different people. Like we gravitate specifically towards a specific discipline, with the OT being the one that can flip either one way or the other. I always joked and called myself the MacGyver OT because I could make anything. Like,
yes, that's right. That's right.
So,
and as a PT, I'm always very jealous of that. I mean, I kind of live vicariously, but you know, I'm like, maybe I should go back to school and do both.
Yeah, I think Cindy, Mr. Collins,
I
should have been an OT.
Yeah, I've met a few. So what would you guys say to people who are listening, who are family caregivers, who have maybe heard from other people that it doesn't make any sense because the person living with dementia isn't going to be able to be rehabilitated, right? They can't necessarily improve. So it's not beneficial for them to necessarily receive PT or OT or speech therapy. And doctors will say that to people.
I've had people say that to me.
Right. So what would you say to a family member who has that in their mind, and why can we, you know, what can we say to help them understand that there's a tremendous benefit that we as the rehab professionals offer to these people and their family members related to dementia caregiving, even if the person couldn't get quote unquote better?
Yeah.
Right. As a physical therapist, my first thing is, you know, because when you get those doctors that say, well, there's nothing that you can do, you know, there's, to me, first of all, you have to try. And second of all, you don't ever want your loved one or your you know, client, just sitting and doing nothing because we don't think there's anything that can be done.
Right.
You know, there is always a combination of things. There are always many different things to try. And I know, you know, I've seen a lot of dementia clients, and as far as that goes, everybody's at their different level. But to me, you know, whether it's verbal cues or tactile cues or that procedural, you know, let's do some counting, let's do some, you know, getting things in a sequence that maybe they can recall. Anything like that in my opinion, as a PT, I want them up and moving as much. I want them doing as much as they can, because, you know, we're not, you know, it just infuriates me when, you know, we're not just going to not do anything for them. We want them to be as functional as they can be.
Functionally independent. I think that's the big thing. Independent, it looks different.
It does look different. It does. And you don't have to do it all yourself, but there can be certain levels. And yeah, so when the doctor, it gets me up and it makes my hair set on fire when the doctors say, well, there's no use. Oh, please do not say that.
Yes, I 100% concur.
Yes.
And one of the big things that I want people to understand about PT specifically related to dementia and dementia caregiving specifically at home is there's so many tricks and techniques that the physical therapist can teach you to actually make it easier to move that person.
That's right.
Absolutely.
But if you don't know those tips and tricks, then you're making your job as the family caregiver 10 times harder, because now you're working against what the person living with dementia is doing because the caregiver doesn't understand.
Right. Absolutely. And
I was just going to say, to me, I feel like the functional independence, you know, and letting, and maybe it's something that they have done their entire adult life, right? But maybe that skill has slipped a little bit, and maybe they need cue cards, or maybe you need to set the toothbrush, toothpaste out on the counter so that that's their visual cue, right?
Right.
it says, besides being functionally independent, the dignity. That for
Absolutely.
me is the biggest part of it, is allowing this fully grown adult to be able to maintain their functional independence with dignity. That is top of mind for me whenever I treat people. So,
Yeah.
Absolutely. Well, you bring something up really interesting, Christina, related to the, the toothbrush and so on. I'll never forget when working with so many family members, one of my first cues, like when I go see people, is I always take them to the restroom. Always. That's my big way of seeing how they're able to process their environment and what they can do. But I'm also very observant in the bathroom, and I'm very observant of the mouth care, right? Because we all three of us know that if your mouth care goes away, then you're more prone to getting pneumonia and other things like that. But then you'll have family caregivers say something like, well, mom's not brushing her teeth anymore. Well, mom's physically able to, but mom can't think through the process.
Right.
So having these tricks and techniques for families then to understand how to actually keep that functional independence, I think is so important. Did you know that caring for a person with dementia doesn't have to be this hard? If you are struggling and you would like to join our next free workshop, the topic of the workshop is 3 tips how to avoid challenging dementia behaviors without stress, anxiety, or burnout. I invite you to walk away with science-backed dementia caregiving skills that many professionals don't even know after attending this free workshop. If you'd like to register, message me the word workshop on Instagram or check out the link in the show notes below.
Yeah, it really is. And just the dignity and stuff that goes along with it. It reminds me of, I had a resident when I was in long-term care that I was seeing. She perseverated. She'd had a stroke and she perseverated on the word whatever. And so you could tell, I mean, first of all, the word whatever can be off-putting as far as communication. If you could have picked another word, but you could always tell what mood she was in based on how she responded with the word whatever. And so I would go, hey, it's Christina, and let's do some speech therapy. And if she was okay, she'd be like, whatever, but if she was upset, she would cry out, whatever. And so then it was up to you to figure out what was going on. So I was working with her at a table one day, and I walked up to her and I said, hey, you know what? Today's my birthday. Will you sing the happy birthday song? I've been working with this woman for a month or so. And she's like, and so whatever. And so when I said, today's my birthday, can you sing the birthday song to me? She sang the birthday song to me word for word, because she used to sing in a choir. And she sang the happy birthday song. We've all sung it a million times, right? But she sat right there and sang the whole birthday song to me. And I was just like, to me, it was just a big reminder that we are still communicative human beings, regardless of where you're at in that process with dementia.
For sure.
It's, even if it's yes and no, even if it's yes, or no, or a shoulder shrug, or turning one way to your head, there's still things that we could do to communicate to our love, sitting there with a magazine and going and doing that reminiscing with a magazine, or, just looking at things and co-attending to the same activity.
Right.
Yeah,
for sure.
and setting them up for saying yes or no, or just even if it's just a grunt or whatever, it's still communication.
For sure. Now, probably to me, the biggest thing is that you and me and Cindy, we know this because we breathe this every single day. But when you're a family caregiver at home and you haven't been around this, because quite frankly, one of 2 things have happened. Your doctor hasn't diagnosed it, because doctors don't want to diagnose dementia because they believe there's nothing that we can do. So therefore, why am I going to tell this family that this person has dementia, which I think is a big, big mistake.
Yeah.
Or you're at the beginning process, you have a diagnosis of dementia, but you're still functioning, you're still coping, you're I use the analogy, it's a terrible analogy about the frog, the frog in cold water.
Yeah.
And because you're coping and coping and coping, you don't necessarily recognize or know, because you've not been around a PT, an OT, and a speech therapist,
Right.
that how much easier your life can be if you ask your doctor to actually access these services earlier on.
Right.
I'll use Cindy as an example. I have a client that I'm working with right now in my group that the family told me one day, oh, but Dad falls. He fell. I'm like, ding, ding, ding. I'm like, how many times has your dad fallen? Oh, well, it's only like once or twice a week.
Oh, wow.
And I'm like, what do you mean once or twice a week?
Yeah,
I'm like, not even one fall, right?
Yeah.
So if a person falls at home, the automatic thing should be call your doctor and get a prescription for a physical therapy evaluation, because falling is not normal, right? And we know that, but families don't.
No. Yeah.
And the same thing with Christina with speech therapy. If mom or dad is eating and you notice that they're coughing or choking, that is not normal.
Right.
And they need a speech therapist. Or if mom or dad can't get in and out of the tub,
Right.
it is not normal. You should be asking your doctor for a referral for therapy. Because there is so much more that we can, whether it be at home, in a long-term care facility, in an assisted living, wherever, like we talked about earlier before we even got on the recording, is that we need families to understand that they need to advocate for themselves.
Absolutely.
Yeah, they really do.
Absolutely.
They really do. And the big thing that we try to point out to families is change in condition.
Yeah.
Change in condition.
What does that mean?
And it can be a small change. If they're not doing what they were doing before, if something has happened, in my opinion, that can trigger at least an evaluation. At least
Absolutely.
evaluation, and so that's what we always try to encourage. You've got to get on the phone to your doctor, and use the word change in condition. My
Yeah.
family members had a change in condition.
That's a
They're
magic-
not-
magic phrase. Right.
Yeah, I love that, Cindy. Thank you for saying that, because it is up to us to teach families
Right.
what to say to, like, I'm a healthcare provider. I don't know if you guys are family caregivers yet or not, but I, as a healthcare provider, I have had a hard time getting the doctor to navigate this for my dad. I'll use my dad as an example. I noticed his cognitive impairment about 2 years before the shoe dropped, right? He was scammed out of some money around Christmas, but he was still functioning pretty good. So, you can't get involved sometimes until you can get involved. But when he got super sick about 2 years ago, and I was able to actually get into his medical record and look at it, I read through everything. And 2 years before that, like around the time he was scammed, the doctor actually asked him, his primary care doctor actually asked him, has anybody told you you're having a hard time remembering things?
Wow.
And guess what? The answer was yes, my daughter. And guess what?
Yeah.
Nothing.
Nothing.
Wow.
Nothing. Right?
Well,
So if us as healthcare providers, the takeaway for people is, if we as healthcare providers have a hard time navigating
Right.
the healthcare system, it is more challenging for people who are not healthcare providers. And it's up to us as healthcare providers to teach them what to do. So the words change in condition
Right.
is exactly what you need to do. So I actually want to switch tracks just a little bit and talk to Christina. And the reason I want to talk to Christina is a couple of, well, number one, it's near and dear to my heart, but we were talking earlier in the conversation about aspiration, right? Which, for people who don't know what that means, just means something went down the wrong way.
Yeah.
Okay. Can you give people who are listening, who might be helping somebody at home, some things to look for related to when things are going down the wrong way, because like we said earlier on, eating and drinking is one of the things that ultimately causes people living with dementia to not thrive anymore.
Right.
Can you give people some things that they could look for at home?
Yeah, because, first of all, not everybody, when something goes down the wrong tube, will cough. And we
Right.
call that silent aspiration. Anything that gets below your vocal cords and it's on its way down to your lungs, you've aspirated it. It doesn't matter if you can expectorate it, it's still considered aspiration. And some people can live with a lot of things going down into their lungs. And some people just takes one time. But usually the common denominator is at some point in time, you might get pneumonia. You might get aspiration pneumonia. So looking for things that aren't obvious, like coughing or choking, would be like a runny nose, watery eyes, sneezing, it's things that we don't necessarily equate to it. Now, let's say somebody's had a kind of, maybe they were sneezing after, during a meal, they were sneezing. Something could have gone down the wrong tube. So I'd say maybe 30 minutes after the meal to an hour after the meal, take their temperature. People that actually aspirate, because that's a foreign substance in the wrong place in your body, right? It's in your lungs. It's an invader to your body, and you'll spike your temperature like you have an infection. And so, but you'll spike it and it'll go back down to normal. So I usually tell my people, if you're concerned about it, first of all, tell your doctor.
Yeah.
And first of all, tell me how often this happens. And then make sure you let your doctor know, because there are things there are x-rays, a modified barium swallow study, or what we call a cookie swallow study, that can be done to actually watch your loved one chew and swallow this barium cookie and watch it go down and see where it's getting hung up, or is it going down the wrong tube? Is it just penetrating to your vocal cords, or are you aspirating it? And we could just tell a lot from that. So I would make sure that you let your physician know, but just those little tiny things, watery eyes, runny nose, you might spike your temperature, maybe some throat clearing, not necessarily coughing. I want people to know too, the difference between coughing and choking. I was working with a woman for swallowing issues, and I had a CNA tell me that he gave my patient the Heimlich maneuver when she was choking. Well, she wasn't choking, she was coughing. So she was able to get air because she could cough, right? He broke a couple of her lungs giving her the Heimlich maneuver. He broke her ribs, giving her the Heimlich maneuver when he really didn't need to. And so I needed to go in. I went in and educated the CNAs on what's the difference between the two. So I think that's important too. And something else, this doesn't help.
And lifting your arms up over your head does not
or whacking them on the back. That's not a thing. We're just tucking your
one
chin.
of my favorite ones when people are taking their pills and they throw their head back.
Yes, I know. You want to see a speech therapist hair go fire. Do that around a speech therapist. I mean, whoa, yeah, don't toss your head back. But we do that, right?
Everybody does that.
Everybody does
for sure.
Man, yeah. So those are some things to see.
One of the things that I find fascinating when I would work in home health, or when I would be with somebody, and, some of the signs and symptoms that you talked about, they take a drink and then a couple of seconds later, they're clearing their throat, or they're coughing or whatever. And then you'll ask the family, or you ask whoever's in the room, so how often does your mom, cough on drinking? And so, oh no, that's always, she's been doing that for years. Or no, she's not choking, it's not going down the wrong way. And so I want people to understand that every time they're putting the person that they love at risk for getting pneumonia, and pneumonia can put them in the hospital, or it can change their life, or even have them pass away because of the pneumonia. So
I always tell my patients, pneumonia is nothing to mess around with.
Right. Yeah. So my dad, actually, when he got sick 2 years ago, I don't know if I ever shared this with you guys, but he had 2 separate hospitalizations. He was in the hospital, kind of had COVID, lots of other stuff going on. But I think during that period of time that he was in the hospital when he had COVID, he was so sick, he actually aspirated something.
Ah,
And
yeah.
30 days later, we end back up in the hospital. He had a 7.5 centimeter by 5 centimeter abscess in his lung from aspirating.
Wow. Yeah.
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 Mm.
You know, changed his life. All, wasn't swallowing problems. He was just so sick. He aspirated something because he was so ill.
I mean, you can aspirate your own secretions,
Oh, I've done that a lot.
I mean, it's still aspirating. And even though it's your own secretions, the mouth is not a very clean environment.
No.
And you aspirate saliva even that has some bacteria that's down in your lungs, and that increases your risk for developing aspiration pneumonia. Yeah, it's scary.
For sure. Did you know that caring for a person with dementia doesn't have to be this hard? If you are struggling and you would like to join our next free workshop, the topic of the workshop is 3 tips how to avoid challenging dementia behaviors without stress, anxiety, or burnout. I invite you to walk away with science-backed dementia caregiving skills that many professionals don't even know after attending this free workshop. If you'd like to register, message me the word workshop on Instagram or check out the link in the show notes below.
Yeah.
Wow, what a conversation. I wasn't expecting any of this. But, Cindy actually mentioned something before we started the recording. We were just kind of chatting about what we were going to talk about. Cindy, talk a little bit about when you go and work with people in home health, right? And there are two scenarios here. You're working with a person who has dementia and a family caregiver is involved. And then you're working with a person who doesn't have dementia, but the family caregiver does have dementia, and some of the challenges that those cause or results in when you're doing home health.
Right. The biggest thing is the understanding of the dementia, whichever the involved patient or the caregiver, in trying to figure out what is needed as far as the path of treatment, to get past that, especially if you have a caregiver that's actually is the one that has dementia, you start wanting to try to get other people involved, other family members involved, to try to make sure that the caregiving is safe, for the individual that is needing the care at that time. But the individuals that we're treating with dementia, it's very interesting because, again, we talk about, no two people are the same.
Yeah.
And it's kind of a puzzle in trying to figure out what is it that's going to help their caregiver, especially on the physical part for me, getting them up, getting them off the toilet if they need more help. There's been time and time again that you may go into a house and they're like, oh, mom is not getting up. We're having to lift mom out of the chair. And trying to just figure out that, and maybe it's step-by-step verbal and tactile touching cues, and saying, okay, let's move this hand here, or hand over hand tactile cues, you take their hand and place it. And it's amazing to see, because then the family member turns around and is like, wait a minute.
How'd you do that?
She just got up.
She's got the touch.
Yeah.
Magic, right?
Yes.
It's magic. And that's
it's like a mic drop. Boom.
right. Yeah. And then, I've been doing this long enough now that I have also realized that, especially in later stage dementia, people with later stage dementia, that sometimes I'm not the right person, even though I have all the skills. And I'll never forget this one particular gentleman. He's passed away now. I stayed in touch with his family for a long, long time. Sweetest guy. Had a grandson who was his primary care partner, and he would do anything for his grandson. And I'll never forget this. I had a student. So now, I'm trying to be the I got this, right? I got a student watching me. I've got this patient with severe end stage dementia, but he was ambulatory still. And he wasn't speaking much anymore. He spoke words, but he would laugh. He would always laugh at me. And I was trying to show her a technique to get him up out of a chair.
Mhm.
And I know full well, give him enough time. So I gave him the prompt and I said, stand up. And we waited and we waited. And then I tried the tactile cues. I did everything to help that guy get up out of the chair.
Mhm.
Finally, I stopped. I looked at my student and said, I'm like, his grandson's going to get him up.
Yeah.
Grandson walked over and he's like, Grandpa, come.
Yeah.
Popped right up out of the chair.
Yeah.
And I use that example because I want families to understand that, it is a trust thing sometimes too for the person who has dementia. And if they don't trust the caregiver, whether it be a paid caregiver or a not paid, like I was a paid caregiver at that moment, then they're not going to feel comfortable or safe in doing whatever it is that we can do. But there's just so much benefit that every person at every phase of a dementia caregiving journey can get from actually having skilled therapy in the house.
Right. Yeah. Right.
But I also want to, I'm going to throw therapists under the bus for a second. Not all therapists are created equal.
Correct. Yes, correct.
And not all therapists should be treating people living with dementia. It's not their forte.
Correct.
Yeah,
exactly. And so if you have a quote unquote, as a family, a bad experience with a therapist, perhaps coming in, an OT who only does arm exercises with somebody who doesn't need arm exercises, or, whatever the case might be, just remember that that particular therapist might not be really good with working with people with dementia. And that doesn't mean that the therapy didn't work.
Yeah.
Right.
It just means the therapist didn't work.
Right. Or they might not mesh. Their personalities might not mesh. We all don't like the same people. So,
right. Right.
And I got in trouble a lot.
And there again is the advocacy, and in knowing, hey, it's okay to change.
Yeah.
It's okay to ask for somebody different. It's okay to go with a different company.
Yeah.
Because like you said, we don't want them just to try once and stop.
Yeah.
We certainly don't want that. So yeah,
I guarantee you the therapist has other patients they can see.
Yeah.
And
don't worry, you're not going
to hurt their feelings. Yeah.
Right. And if you've been a therapist longer than 5 minutes, you're not going to mesh with everybody. And it's okay. And you're not going to fight in bulk because, somebody said they're not they can't work with you.
Right.
It's okay. We got pretty thick skins, if you've been a healthcare provider for a while.
Oh, yeah.
So tell us a little bit about what you guys do with Adaptive Equipment Corner.
So Cindy and I, we were still in our therapy careers at the time when we started it. And at the time, we were both in home health. I was working in home health at the time too. And we were thinking, because we just started bringing our laptops into the home, but we were still doing paperwork and stuff. We were making that transition. So Cindy and I thought, wouldn't it be helpful for us if we would make these little short videos of frequently asked questions that therapists get all the time, put them on YouTube for anybody to see, take our laptops and set our caregivers up with the videos while we did paperwork. So we didn't have
it's a great idea.
Yeah. So we started doing that in 2015, mostly for ourselves. And then in 2018, it started getting traction on YouTube. So we decided to develop a website. And then we developed a platform to house our videos that we have. And currently today we have over 200 videos in that caregiver resource library is what we call it, at AECorner.com. And we sell it for a subscription. So, so what Cindy and I do, we're really just truly therapy nerds. We make videos to show people, caregivers or senior partners, senior spouses, or even professional caregivers, how to provide safe care to a loved one or to a patient And we sell that as a subscription. So that's kind of what we're doing. In the meantime, while we were selling that, we started doing that as a business model. We got a lot of companies that would send us their product. And so we started taking these products, and we found that, especially in home health, you're just like, man, if this caregiver just had the right tool, their life would be so much easier. So matching the product up with the caregiver, people don't know what they don't know. So they start sending these products. So we started making these quick little videos to show people, this is what this is. This is the people that would benefit from it. And here's where you can find it.
Right.
Maybe it's for you, maybe it's not for you, And so we've got all of that stuff out on our YouTube channel. So, and then I always like to tease Cindy, we're all over social media. We're on Instagram and Facebook, and I always tease Cindy, we're going to change the name of our TikTok account to Two Old Ladies on TikTok.
Yes.
Because we get a lot of followers on TikTok too, which is, which is great because there are different kind of audiences that we serve on each different platform. So we try to make sure we get them all. But so that's kind of what we do now. And then now we've got all these products, and what we've been doing is packing them up in our van, and we got a minivan, packing them up in the minivan and going to senior health fairs and to caregiver health fairs and setting up a booth. We look like a flea market at other places because we've got so many products and stuff. But then just giving people the opportunity to engage with these products, because you can get any of it online, but it doesn't, how to use it safely. So giving them the opportunity to engage with the product and then ask the therapist questions about their specific situation. So
I love it. So speaking about the video library, I've had the privilege of actually seeing your video library, and there's so much gold there. One of the biggest things that I truly, truly appreciated about the level of depth and time that you took to actually code things for people so that people know where to go actually look, like what's, when somebody's only needing a little bit of help or needing a little bit more help or needing a lot of help. And that was extremely valuable.
Excellent.
And then the other thing that I really appreciate about what you guys are doing is the way that your educational videos are put together are so practical. It's not therapy talk. We can pull out the big fancy words, all three of us. But you bring it down to a level for people to actually, it's practical. Like practically, how can you use this particular thing to help you with this particular problem? So thank you for doing that for the people out there, because there's just so much value in it. A lot of your videos are free because they're on YouTube, but a lot of the caregiver videos that will make somebody's life easier for them really is behind the subscription model. And I'd really encourage people, the price that you have things at is ridiculous. I mean, it's less than the price of a takeout pizza. And if you consider what 1 month in a nursing home is, whether you're the family caregiver who gets hurt because they didn't know how to transfer somebody, or a person living with dementia who gets hurt because the people don't know how to help them, a little investment to help you keep somebody at home, if that's your desire, I just think is well worth it.
Thank you. We try to keep the videos short. We appreciate the time that caregivers, or the lack of time that caregivers have. We try to be respectful of that time by keeping the videos around 5 minutes, if possible, and we also, each subscription, when you subscribe, it's a monthly basis and you can cancel anytime. So maybe you're bringing mom home and you need to learn how to do transfers, from the hospital, and maybe she had a knee replacement, $10 a month for the video.
It's
you
worth
learn
it.
how to do it. And then when you're done with your caregiving journey, you can cancel your subscription. So we just really want to help people. We want to help caregivers and individuals live at home as long as possible.
That's right.
For sure.
That's what everybody wants anyway.
So how can people connect with you guys afterwards if they're interested in finding out more?
Yeah, if they want to go to our website at
Mhm.
aecorner.com, we have a contact page. You could call us, you could send us an email, you could come find us on your favorite social media channel.
That's right.
You could
Reach
go
out
look for the two old ladies on
to a little
TikTok.
two old ladies on TikTok.
That's right.
Yeah, that's
And
right.
you can find all of our social media handle channels at the bottom of our website
Yep.
at aecorner.com.
Yeah,
Yep,
Rachel,
and we can put all of that in the show notes too for people.
Right.
And I can tell you from personal experience, working with you guys has been a blessing. You are very gracious and very easy to communicate with and always willing to help. That's been the biggest thing to me is I can see the the caring that you guys have for the people that you're serving, and you're doing such a good job.
That's
So
very kind. Thank you,
Appreciate
Liz.
that.
thank you for being here with me today.
Thanks for
you.
having us.
Oh, you're very welcome. We're going to do this again.
That's
Excellent. I'm looking forward to it.
Thanks for joining me today, Success Seeker. I pour my heart and soul into this program to serve you. You can serve me by leaving a review on Apple Podcasts and join our free Facebook group, Dementia Caregiving for Families. It's a positive and proactive space to navigate dementia caregiving together. Get practical tools and find support, but without the verbal vomit. Be a part of our community where we seek to find peace of mind and ease despite the dementia diagnosis. So join today and see you next time as our flight takes off.